Thank you, Premier. So the Premier's indicated our testing numbers, and it's pleasing that there was some increase in testing overnight, but we do need the community to respond for testing. Overnight, a new case of COVID was notified in a resident of Bondi, and this person shopped at the Maya Bondi Junction on Saturday the 12th, June 12th, at the same time as the initial infectious case in this cluster, the limousine driver. The new case had onset of symptoms on June 15th and is considered infectious from June 13. So while infectious, this latest case visited venues in Redfern, Newtown, Bondi Junction and Campbelltown, and travelled on train from Newtown to Bondi Junction on June 13th and from Bondi Junction to Campbelltown and return on June 15th. The exact times and locations will shortly be posted on the New South Wales Health website. Rapid testing overnight has showed this person's household contacts are not currently infected, but they will now quarantine for 14 days. What's important is we are concerned that people may not have been aware of their exposure, particularly not conscious that they've visited Maya at Westfields or been to those venues at Westfields. We know that people do go to shopping centres and you may be not conscious. So please be particularly aware of your movements on the days. Check the website. But we also know that people have to move, whilst people might recall what shops they visited, they clearly move around the Westfield shopping centre when they're doing that. And so again, we can't exclude that someone has had intermittent contact with that person. And so again, being very vigilant if you've been in that precinct or any venues or passing venues that have been listed. The whole genome sequencing has confirmed that the case reported yesterday, the patron of the Belle Café at Vaucluse, is an exact match to the initial case. Now that's expected, but this indicates that the initial case was highly infectious, as transmission must have occurred through fleeting exposure, noting that the woman who caught the infection at the cafe was actually seated outside and there was no known contact with the initial case. Now, obviously, we can't rule out that there was some crossover when they were ordering or other things, but again, we're just highlighting that we have observed these transmissions in settings where we would normally see outdoor dining as a lower risk setting, and we would normally see shopping centres as a lower risk setting where you're unlikely to have close contact. So this just highlights that we need that extra vigilance in the community. So given the emerging evidence of the initial case's highly infectious status, today New South Wales Health will review all of his other exposure sites and may upgrade several from casual to close contact venues. And I did flag that yesterday with you that we'll continually review. So anyone at the Maya Bondi Junction level 2 or 4 between 11:15 to 11:50, or the David Jones Bondi Junction level 1 between 10:55 to 11:15 on June 12, it is now considered a close contact and must get tested and quarantined until June 26th. Patrons of Westfield Bondi Junction Food Court level 5 on June 13 from 1:15 to 1:45 are now considered casual contacts and should get tested and isolated until a negative result is received. And if you have been to any of the sites visited by any cases, please monitor the New South Wales Health website for updates to the directions and isolate and get tested if you develop any symptoms. So again, can I thank this gentleman for coming forward? I believe that he initially was not aware he was at a venue, and that's why of concern. And I just want to again highlight the importance of going back over your movements, check your receipts and your bills, check your movements, and please follow the public health action. In relation to the other case that we reported yesterday, an expert panel, so that was the case related to the gentleman in Western Sydney, in Castle Hill area, we were unable to conclude that that person was a false positive or an old infection. His results of his serology did not help us because they were negative. His repeat testing was negative, indicating that at that point in time he wasn't very infectious or infectious, but what we can't preclude is that he was infectious prior to that time. He will be undertaking further testing, but for the abundance of caution, we need to act as if that he was infectious, and we have issued text messages and contact tracing initiated yesterday. Pleasingly, his household contacts were negative.